It's important to follow the directions on the package when using Systane Dropperette, single-use dropper. If you have any questions, ask your doctor or pharmacist. Do not use the solution if it has changed color or is cloudy. Some eye drops need to be shaken before use, so check the label to see if this applies to your product. You can use the drops as often as needed, while ointments are usually used 1 to 2 times daily as needed. If using an ointment once a day, it may be best to use it at bedtime. When applying the eye ointment/drops/gels, wash your hands first to avoid contamination. Be careful not to touch the dropper or top of the ointment tube or let it touch your eye. Always replace the cap tightly after each use. Tilt your head back, look up, and pull down the lower eyelid to make a pouch. For drops/gels, place the dropper directly over the eye and squeeze out 1 or 2 drops as needed. For an ointment, hold the tube directly over the eye and gently squeeze a small strip, 1/4 of an inch or roughly 6 mm, of ointment into the pouch. Spread the medication by slowly rolling your eye in all directions. If you wear contact lenses, remove them before using most kinds of eye lubricants, but ask your doctor or pharmacist for specific guidelines on when you can replace your contact lenses. If your condition lasts or gets worse after 3 days, tell your doctor. When you first use Systane Dropperette, single-use dropper, you may experience temporary blurred vision and minor burning, stinging, or irritation. If these effects persist or worsen, it's important to notify your doctor or pharmacist right away. If your doctor has prescribed this medication for you, it's because they believe that the benefits outweigh the potential side effects. Most people who use this medication do not experience serious side effects. However, if you do experience any serious side effects such as eye pain, changes in vision, or continued redness and irritation in the eyes, it's crucial to inform your doctor immediately. Although rare, a severe allergic reaction to this medication can occur. Seek medical help immediately if you notice any signs of a serious allergic reaction, including rash, swelling, severe dizziness, or difficulty breathing. This is not a complete list of possible side effects, so if you notice any other effects not mentioned, it's important to consult your doctor or pharmacist. If you're in the United States, you can call your doctor for medical advice about side effects, or report any side effects to the FDA. In Canada, you can also call your doctor for medical advice about side effects, or report them to Health Canada. Before using the Systane Dropperette, single-use dropper, it's important to discuss any allergies with your doctor or pharmacist. This product may contain inactive ingredients that could cause allergic reactions. It's also important to consult with your healthcare provider if you have any health problems before using this product. After applying the Systane Dropperette, you may experience temporary blurred vision. It's important to avoid driving, using machinery, or engaging in activities that require clear vision until your vision has cleared up. It's always best to prioritize your safety. When using Systane Dropperette, single-use dropper, it's important to be aware of potential drug interactions that may affect how your medications work or increase your risk for serious side effects. Be sure to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. This will help ensure the safe and effective use of Systane Dropperette, single-use dropper. Always follow your doctor's recommendations for the best benefits, daily dosage, and optimal timing for using this medication. If Systane Dropperette, single-use dropper is swallowed, it can be harmful. In case of an overdose with serious symptoms like passing out or trouble breathing, it is important to seek immediate medical help by calling 911. Otherwise, contacting a poison control center is necessary. U.S. residents can call their local poison control center at 1-800-222-1222, and Canada residents can call a provincial poison control center. When using Systane Dropperette, single-use dropper, it's important to note that some products may contain preservatives that could potentially harm your contact lenses or cause irritation, especially for those with allergies. Be sure to check the product package for more information and consult with your healthcare professional if you have any concerns. As for the benefits, this product helps to lubricate the eyes and relieve dryness. The recommended dosage is 1 to 2 drops in the affected eyes as needed. It is best to use the Dropperette when you feel discomfort or dryness in your eyes. This product is typically used on an as-needed basis. It is important to follow the directions on the package and from your healthcare provider. Make sure to check the storage information on the package and protect the dropperettes from freezing. If you're using preservative-free drops from single-use droppers, you should discard them either immediately after use or within 12 hours of opening. Always check the product package for specific instructions on when to discard. It's important to keep all medications away from children and pets. Remember not to flush medications down the toilet or pour them into a drain unless instructed to do so. When the product is expired or no longer needed, make sure to properly discard it. If you have any questions about storage or disposal, consult your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.